Wollaston, and welcome to Insiders Health TV, where we bring you the freshest happenings in the world of medicine without the quack propaganda. Today we'll be talking about how surgery saved a young girl's face from a rare disorder. And we'll hear from Danica Quinn, who will give us all the coverage on that celebrities are doing in the world of health. Imagine waking up with a small smudge on your forehead and wondering where it came from. Now imagine finding out that that smudge was just the first sign of a debilitating and rare disease. This was exactly what young Christine Honeycutt and her family were dealing with when they discovered she had Perry-Romberg Syndrome, which caused her own immune system to turn on her, allowing one side of her face to develop normally, while the other was deteriorating. The autoimmune disorder that affects roughly 1 in a million people gets worse with time and can also cause seizures and other neurological problems. And while the prognosis isn't reassuring, her parents took it into their hands to not just allow the disorder to take hold. Rather than allowing it to progress to completion before plastic surgery comes into play, the normal route, they decided to meet the problem head-on. Dr. John Siebert reconstructed what was dying under her face and built it back up with working blood vessels, actually preventing further atrophy and growing along with Christine as she matures. And while some are skeptical, he's almost never had to perform a second surgery, although that will be the case if the disease lasts long enough. But for now, besides some swelling and a small scar, Christine is back to normal and looking wonderful. Some might even say that her smile is 1 in a million. Now let's check in with Danica Quinn, who will be giving us her Hollywood Healthbeat. Danica?
Hi there, I'm Danica Quinn, and this is Hollywood Healthbeat, your lifeline to the hottest health happenings in Tinseltown. The Grammys are always a big topic of conversation. The celebrities, the dresses, the winners, the performances, but the biggest story of the night didn't happen on the stage. It happened just outside the Staples Center, where a local news reporter appeared to have suffered a stroke on live air. KCBS TV reporter Serene Branson was covering the prominent award show when her speech began to slur and her sentences became incoherent. She appeared panicked and made a desperate struggle, an attempt to throw the cue back to the station's anchor. Branson was immediately rushed to the hospital where her vitals checked out normal. She was sent home to rest and we assume watch the rest of the show from the comfort of her own couch. But there was speculation from viewers and YouTubers alike that Branson must have suffered some kind of stroke, citing the droop of her face and nature of her diction. Others wondered if maybe she had a few too many glasses of celebratory champagne. Well, it turns out neither was true. After conducting a brain scan and blood work, doctors at the University of California said that Branson suffered a severe migraine. UCLA neurologist Dr. Andrew Charles says a migraine is a complicated brain event that cannot be compared to your everyday headache. These episodes can be incredibly debilitating and in some cases mimic the symptoms of a stroke. About 20 to 30% experience warning signs, including flashes of light or zigzag patterns across their vision. And Branson experienced facial numbness, hence the debilitated and slurred speech. The reporter is back in good health though, and now she has a great excuse if she ever flubs her lines or wants that extra pre-show cocktail. Until next time, I'll have my finger to the pulse of Hollywood. Back to you, Kim.
Thanks so much, Danica. Hope you're enjoying your rest after a busy Oscar season out there. That's it for this edition of Insiders Health TV. I'm your host, Kimberly Wollaston, and remember, it's your health. We're just helping you think outside the box.